You're on the Bible Forum. In the midst of the COVID-19 tragedy, has COVID-19 been a surprise to you? The basic charge is that President Trump did not do the right thing. Or if he did, he didn't do enough of it. Or he didn't do it soon enough. Soon enough to avoid the outbreak here in the United States. Well, here are some of the facts and a timetable. In China, a medical lab receives samples from Wuhan hospitals on December 26. Chinese scientists sequenced the virus and discovered an 87% resemblance to SARS. But Chinese regime officials ordered them to surrender or destroy the virus samples. Communist Chinese Party censors deleted the news report of the destruction. This revealed by something called the Caixin Global from the Chinese internet. Dr. Li Wenliang, a 34-year-old ophthalmologist at Wuhan Central Hospital, warns other physicians about the virus on WeChat and advises them to wear protective gear. Dr. Li will be forced to sign a confession renouncing his statement and will then die. A colleague, Dr. Ai Fen, director of emergency at Wuhan Central Hospital, will later denounce authorities publicly on March 10 and disappear by March 16. Chinese government officials inform the World Health Organization of the coronavirus and say that the disease is associated with the Wuhan Hunan wholesale seafood market. The warning is set to discount human-to-human transmission. Now keep in mind, this is now December 31st. Warning will become the basis for China's subsequent insistence that it was transparent from the beginning. After all this, upwards of 175,000 Chinese left Wuhan, traveling to their ancestral homes for the Chinese New Year. 7 million would leave before China imposes travel ban. By January 21, the disease is already out of control. Over 900 people traveled to New York every month during this time from China. By the time travel was limited at the end of January, outbreaks had already occurred in 30 cities across 26 countries. On January 1st, officials at the Hubei Provincial Health Commission ordered a laboratory to stop testing samples of the new virus from Wuhan, to destroy all existing samples, and to, quote, immediately cease releasing test results and information about the tests, end of quote. On January 3rd, the Chinese central government officially rejected U.S. government offers to send medical assistance to China. On January 12, nearly 2 weeks after being notified of the outbreak, a WHO news release assured us that, quote, based on the preliminary information from the Chinese investigation team, no evidence of significant human-to-human transmission and no healthcare worker infections have been reported, end of quote. It continued saying, at this stage there is no infection among healthcare workers and no clear evidence of human-to-human transmission. January 13, first report of a case outside of China. Thailand reports the first known Wuhan virus case outside of that country. The day after, on January 13, the WHO doubled down on the claim, and then on January 14, they tripled down on it. On January 14, World Health Organization sends out a message without questioning the credibility of the source that said, quote, preliminary investigations conducted by the Chinese authorities have found no evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. January 16, Chinese Lunar New Year celebration. Wuhan residents go to a government-sponsored fair, citing government statements that the health crisis is over. Dr. Maria van Kerkhove, speaking at a WHO press briefing, said the World Health Organization official said she suspected human-to-human transmission of the coronavirus. She said, I'm a MERS, M-E-R-S, specialist, so my background is in coronaviruses and influenza. Quote, right from the start, from the first notification we received on the 31st of December, given that this was a cluster of pneumonia. So I immediately thought, given that this is a respiratory pathogen, that of course there may be human-to-human transmission. January 20, renowned pulmonologist Zhong Nanshan, an 83-year-old veteran of the SARS crisis who is considered a national hero, appeared on state media to announce the virus was in fact transmissible between people. January 22nd, the Chinese Communist Party's English language Global Times calls the virus Wuhan pneumonia for the second day in a row. On January 23rd, after delaying for an extra day of deliberation, the World Health Organization decided not to declare the outbreak of pneumonia caused by a new coronavirus to be a public health emergency of international concern. Dr. Anthony Fauci, director of U.S. National Institute of Allergy and Infectious Diseases, says on an American Medical Association podcast that the risk to the U.S. of the coronavirus is small, and that all 5 patients in the U.S. had traveled here from China. January 24, Science News, no human-to-human transmission has yet been reported outside of China, according to WHO. January 26, Fauci says in a radio interview that the American people shouldn't worry about the coronavirus, saying it's a very low risk to the United States. January 29, President Trump launches a 12-person interagency coronavirus task force led by Health and Human Services Secretary Alex Azar. The U.S. begins evacuation of American citizens from Wuhan. January 31, WHO leader declares a public health emergency of international concern over the novel coronavirus. Director Tedros adds that there is, quote, no reason for measures that unnecessarily interfere with international travel and trade, end of quote. February 1st, U.S. orders travel restrictions. The New York Times ridicules the move. Sharply curtailing air travel to and from China is more of an emotional or political reaction, said Dr. Michael T. Osterholm, an epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Joe Biden and the Chinese ridicule the action. February 24, World Health Organization launches international propaganda directives of its own. The Geneva-based organization instructs healthcare professionals worldwide not to say Wuhan virus or Chinese virus. February 27, Associated Press. The Navy said the People's Republic of China naval destroyer lased the American P-8A Poseidon aircraft in an act the U.S. deemed unsafe and a violation of international codes and agreements. The statement from U.S. Pacific Fleet said the laser was detected by sensors on the aircraft but was not visible to the naked eye, and they were weapons-grade lasers. March 12, The Guardian reports from Beijing, quote, diplomats, state media, and officials in China encouraged the idea that COVID-19 came from the U.S. March 13, a March 12 tweet by Chinese Foreign Ministry spokesman Zhao is now a full CCP international propaganda theme. Quote, Chinese Foreign Ministry spokesperson Zhao Lijian claims it might be U.S. Army representatives who brought the novel coronavirus to Wuhan in October 2019. Novel retrospective in Global Times says March 13 is the last time President Trump had positive things to say about the Chinese regime's work against the virus. May 14, China Communist Party labels Trump a racist. In the New York Times, April 11, 2020, entitled, "He Could Have Seen What Was Coming Behind Trump's Failure on the Virus." The New York Times writers said the New York Times article does not mention that on December 31st, 2019, the World Health Organization was notified by Taiwan that the coronavirus that began in Wuhan, China, was spreading by human-to-human transmission. Nor does the New York Times article mention that despite the warning from Taiwan on January 14th, 2020, the WHO insisted that preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus. The New York Times article does not mention that on January 21, 2020, during a television interview with Newsmax host Greg Kelly, Dr. Anthony Fauci said the coronavirus that began in Wuhan, China was not a major threat to the U.S. Kelly asked, the New York Times article does not mention that on January 26, during a radio interview with WABC, Fauci said the coronavirus posed a very, very low risk to the United States. According to The Hill, Fauci said Sunday the American public shouldn't worry about the coronavirus outbreak in China. It's very, very low risk. But it's something that we, as public health officials, need to take seriously. It isn't something the American public needs to worry about or be frightened about. The New York Times does not mention that on March 27, CDC Director Dr. Robert Redfield told Fox News radio host Brian Kilmeade that he agreed with Dr. Fauci's January 26 assessment. The New York Times article does not mention that on January 31st, Fauci stated at a White House press conference that there was a low risk to the American public. What we do hear as a drumbeat is that our president was late to the party and that he should have taken action sooner. What we don't hear is that he took the actions as soon as it became obvious what was going on. So much for our media.